The Pfizer and Moderna COVID-19 vaccines are now being rolled out across the country. Action News 8 anchor Lauren Seaver spoke with two local infectious disease specialists last week to find out more about exactly what the vaccines do and how long they will protect you.
COVID-19 vaccines are being distributed to healthcare workers, first responders, and those living in nursing homes. So the question most of us may be asking, when is it our turn? But there are a few other questions about the COVID-19 vaccine we wanted to ask the experts. First, what exactly does it do?
It was very effective in preventing people from getting ill from coronavirus infection. So that's what that 95% or 94% efficacy was, is that of all the vaccine recipients, virtually none of them got severely ill. And in the very small number that did get ill, they all had mild disease. So the next thing that we would like to know is whether or not, if we're all vaccinated, will that prevent the virus from being spread in the community and from person to person. We just don't know that yet.
Which is why health experts say we will still be wearing masks, washing hands, and practicing physical distancing even after being vaccinated, until they can get more information about whether the vaccine not only prevents disease, but also prevents transmission. So once you get a COVID vaccine, how long will it protect you?
We just don't know. There's a lot of literature coming out that even though antibodies wane, there are other parts of our immune system, memory T cells, memory B cells, that can rapidly make antibodies. And even if you don't have measurable antibodies, you may have protection for a very long period of time. So I can't even begin to answer that question. I can say our hope is that you're going to have immunity for a very long time, and our hope is that the virus doesn't mutate significantly. The likelihood is that every few years you'd need a booster, but we just don't have the answers to those questions.
If you've had COVID-19, do you still need to get vaccinated? Yes. Dr. Radner says the recommendation is waiting 3 months to 90 days after infection to get a COVID vaccine. Right now, the Pfizer and Moderna vaccines are only available for those 16 and older. Clinical trials are already underway for children 12 and older, and Dr. Blum believes once dosing is figured out, the vaccine will be available for children younger than 12. Another question is the safety of the vaccine in pregnant women.
The recommendation is that pregnant women discuss it with their healthcare provider. So it is not an absolute don't get it. And in fact, the American College of Obstetrics and Gynecology, who basically cares for pregnant women, have said, on balance, there's a benefit to getting the vaccine that outweighs any theoretical risk, because we do know that pregnant women are at risk of getting more severe COVID-19, and they're also at risk for having preterm labor from COVID-19.
Lastly, we all want to know how many people have to be vaccinated to reach herd immunity.
Some infections like measles require 98% of the population has to be immune. Other infections are considerably lower. We just don't know with COVID-19, with the SARS-CoV-2 virus. Most of the infectious disease people that I follow are saying probably somewhere around 70% of the population.
Lauren Seaver, KSBW Action News 8.